Hi everyone, my name is Andre Shi. I'm a traditional Chinese medicine practitioner. Actually today I'm going to talk about common cold and flu. So the reason why it's because the past 2 weeks I've caught a flu and and even though I've been taking the medicine myself, it was quite the virus was quite severe. It's quite strong, and so after I almost recovered, I kind of passed it on to my wife, and then it also took her about a week to recover, and now it's kind of we passed it on to my mother, and then all three of us caught the same bug within the past 2 weeks. So because normally when I catch a cold or when someone in the family catches a cold, we just take the herbal medicine that kind of matches whatever the symptoms that we're having, and it will go away very quickly within a day or two. But this time, probably because the virus is really strong, and I had a fever and a chill for almost 3 days, and then after that, I had some other lingering issues like coughing and chest pain and things like that, and that lasted about a couple of days as well. So it took me about a week to fully recover and also get my voice back. And same thing happened to my wife. And even though she didn't have fever for too long, I think it was about a day or two, and then she ended up coughing a lot, like coughing all night and couldn't sleep until I found the right medicine for her. It kind of just as soon as I gave her the medicine, her coughing just kind of stopped, probably like 70% of the frequency, and then she was able to lie down and get some rest. But that last 30% still lasted a couple of days until she's. Even now, she still coughs a little bit, like maybe once every few hours. But when it was most serious, she was coughing like 20-30 times in an hour. Like she just couldn't sleep at all, and it was very serious. And then after we passed it to my mother, and she was coughing too, and she also had fever and chills and like even nausea, vomiting, and it was really, really bad. So today I want to talk about like how Chinese medicine deal with this type of issue, the common cold and flu. In the past, there wasn't. The common cold or flu is a modern term. They didn't call it like that. What they used to call the name is by what kind of environmental factor this person was exposed in. For example, if your person was outside under like a very strong wind for a long time, you're bound to catch a cold, right? So when this happened, they called it wind attack, so meaning this person was attacked by the wind. And nowadays we know it's a virus, but back then they didn't know about virus or bacteria, so that's how they named things. And they kind of, after a long time, they kind of summarized what happened when somebody exposed to wind for a long time. They'll have a certain type of symptoms, and they just name it like that. And so, or if you combine with wind and then cold, and you have like a different type of symptoms of patterns, and they call it the wind cold, and then vice versa. There's also something called wind and heat. Or if somebody's exposed under the sun, like a summer stroke, they call it heat attack or heat stroke. So and then so these are just names for the different patterns of what we call common cold and flu nowadays. But it's very crucial that when your Chinese medicine practitioner differentiates what kind of patterns that you're having, because the acupuncture or the herbal medicine that they're supposed to give you is based on your pattern and your body type. So even though it's you and your family catches the same cold from the same person, but because everyone has a slightly different body constitution, the virus is going to behave can be very different, or it can be like very similar but different, just because our constitution is different. For example, if you have a weakness, your constitution has a weakness in your GI tract, or you have constitutional weakness in your lung, the weakness in the GI tract is probably gonna make the virus go there, and then causing some nausea, vomiting, or some diarrhea, constipation, that kind of issue. But if somebody has a weakness in the lung, then the virus is going to go to lung and cause you like non-stop coughing, or very severe coughing, or wheezing, or shortness of breath. So the virus will do different things to different types of body. So that's why it's very important we don't give the same medicine to just because you have the same disease name. Disease name is very, very modern, westernized concept. In Chinese medicine, we don't really treat by the disease name. So for example, if you have a that's called hyperthyroid, and also another friend of yours have hyperthyroid, because you two are probably have completely different constitution, you're going to have very different symptoms and different patterns, and the medicine that you need to get better is it will be very different. So back to the topic, common cold and flu. That's why even though all three of us, me and my wife and my mom, had the same source of flu, but the medicine that we took are quite different. It's customized to our own constitution, and that way you'll get better faster, because when you're shooting darts, you want to hit the bullseye. You don't want to just scatter your darts around and not hitting the target, right? So that's why Chinese medicine can be difficult at times to actually pinpoint where exactly your problem is. But once your practitioner find out, has a correct diagnosis, and they know where the target is, so they'll be able to give you a very targeted treatment, and then you'll get better faster than not having any treatment, or better than taking any drugs. So back to topic again, sorry. When we see somebody has a common cold or flu, the most important thing that we need to differentiate is where exactly is this disease. Whether it's very superficial, or it's somewhere deep inside your body, or there's an area that's called kind of in between superficial and interior. Let's call it half exterior, half interior. That's the name for it. So when your disease is belong to the exterior, you have symptoms like body ache or joint pain or joint muscle soreness or even some skin conditions. So but when your disease somewhere interior, you won't have body ache, body soreness, joint pain. You have something that will affect your urination, your bowel movement, or your appetite, your what else? Your water metabolism, your sleep, something like that. So the medicine that we give, depending where this disease is very important, because sometimes when I have patients who really couldn't come to the clinic, but they still want to have some advice on what kind of medicine to take or what they can do, but without seeing the patient, it's sometimes, and Chinese medicine, we rely a lot on the patient's pulse and actually seeing the patient, touching the patient, and that gives us a complete picture. But when all these things are missing, we can only ask you about the symptoms. It's very difficult to form a complete diagnosis, and when your diagnosis is incomplete, the medicine or the treatment method that you give, it can probably miss the target by like a very high chance. So that's why I want to teach my patients and people who are watching kind of a very simple way of taking your pulse, Chinese medicine way, so you're able to communicate with your acupuncturist or your TCM practitioner what your pulse is, and give more information, so they have more information to form better conclusions, so they'll be able to help you better. So the first thing I want to teach is how to take a pulse. So allow me to make a drawing. Okay, not very clear. Okay, so this is your thumb, and where you take the pulse is on the wrist, right next to your thumb. So there is a artery here, just right next to the base of your thumb, and that's where we normally take the pulse. So when you're taking a Chinese pulse, you want to use 3 fingers and place it on the wrist. So at the base of your thumb, so there is a bone here. You can feel that there is a protruding bone here. You want to put your index finger next to it, and then the next 2 fingers kind of touching your first finger, touching each other, and then place 3 fingers there. And then you start with barely touching the skin. You want to see if the artery is kind of very close to for example, if this is your skin, and this is where the bone is, and this will be the artery. You want to see if the artery is actually very superficial, close to your skin. So when you have a common cold, and when the virus is at exterior, when your finger kind of touches the skin, you can feel the pulse pounding just underneath the skin. But if your artery is deeper, like in a medium level or a deep level, when you touch, you're not going to feel any pulse. So you have to kind of press the skin deeper in order to find your artery to feel that pulse. So you can start by applying very light pressure and then slowly increasing your pressure until you feel your artery is pulsing. So in the beginning, you kind of want to feel around and press around to feel where exactly the artery is, and then really loosen your pressure to just barely touching the skin, and then apply pressure again so the first is to locate where the artery is, right? And then second is you want to find out how deep the artery is. So if your pulse is very superficial, we call it exterior syndrome, or if the pulse is very deep, we call it interior syndrome. So when you have a common cold or a flu, the first thing that you need to do is find out where this pulse is. Is it exterior? Is it interior? So when you have exterior pulse, that means your virus is exterior, and along the same time you have body soreness or joint pain or body ache, and also chills and fever at the same time, then we can confirm that this is an exterior syndrome. Then you can go ahead and try to your acupuncturist or your TCM practitioner is going to give you something that help you release this exterior by kind of helping your body break a mild sweat. So this medicine usually involves with like cinnamon and ginger, that kind of thing, to kind of help you opens up your pores a little bit to have a mild sweat. So the virus in your exterior can kind of get expelled from the pores along with the sweat. However, if your virus is exterior, then the sweating will not work, because what you're doing, when you're sweating, the virus doesn't come out from the inside, and it will actually give you it will cause other symptoms or other issues. For example, like it can increase the muscle or body ache to a more severe level, and then because you're kind of forcing the body to sweat, so you lose a lot of moisture from your muscles, and that's why you get muscle soreness and achiness. And if you do this multiple times, you're gonna lose too much water, and then you can have if it's very serious, especially for children, the children can have very severe seizure, and it has become an emergency case, and it's very dangerous, and children could actually die from it. So I don't really recommend doing that yourself. And there are type of medicine, Western drugs, that's supposed to also kind of reduce the fever by sweating, and that's an even stronger type of sweating pills, and you can lose a lot of moisture from taking that, and it can cause more severe problem if it's taken multiple times. It can be used, but it's really depending on your constitution. So if your body type or your children's body type is very muscular, very strong, very like a bulky type of body type, and the person never sweats, even if they do exercise, they hardly break a sweat, then you can tell that the pore is very tightly closed. Even when you're having a fever, it doesn't open up to release the heat from inside. So that's the time when we will give we'll give a stronger type of herbal medicine to kind of opens up the pore to release the heat and kind of expel the exterior virus or exterior symptoms along with the sweating. So if you do that to somebody who already sweat easily or who's kind of sweats normally, it can cause some severe issue of like non-stop sweating and losing too much moisture, getting dehydrated, and then causing seizure, like I said. So you have to be very careful of what you're taking. But I know that in North America we don't really the family doctors don't really do that, because they have a better concept of how to deal with common cold. They usually tell you to go home, drink more water, and rest in bed. Or they don't give you medicine, or if you must, they'll tell you to take Tylenol or Advils, because the Tylenol or Advils, they don't really cause you to sweat to reduce the fever. It's basically kind of suppressing whatever is happening. Kind of suppress the bacterial activities in your body, so your immune system is able to concentrate on the cold virus rather than splitting its force to half of it deal with the virus, half dealing with the bacteria that's causing the infection. So that's the idea. But if every time you catch cold you take the Tylenol or Advil, that kind of stuff, it's because it's a non-selective drug, so it attacks whatever good or bad bacteria in your body. So eventually it's gonna like lower your immune system, and you're gonna find yourself catching cold more easily, and each time it will last longer and longer. So I would say I don't really recommend that. The best way is if you find you caught a cold, or you have flu, or even stomach flu, we are able to deal with it very quickly with the herbal medicine and acupuncture. Like you won't believe how fast it'll work. Because normally when I catch a cold, or somebody in the family catches a cold or flu, and then I give them medicine, like within a day or maximum 2, they'll get better like right away. It's because the medicine is customized for their body constitution, and once I know where the virus is whether it's exterior, interior, or kind of halfway in between, there are different type of medicine for that. And then as long as we kind of hit the bullseye, your body is able to expel the medicine, expel the virus very quickly, and then get better right away. So that's why I really recommend you do that. Actually, you don't have to. The Chinese medicine the acupuncture doesn't only deal with pain. It deals with a lot more stuff than you probably didn't know, because in China for 2,000-3,000 years we didn't have Western medicine, but people still get sick. What do you think what they did when people get sick, right? So the herbal medicine and acupuncture is able to deal with this kind of stuff for 2,000 years, until like last 200-300 years, where Western medicine finally made it into China, and then people adopted Western medicine and stopped, kind of gave up using Chinese medicine. I don't know why, but that's what's happening now. But we were able to deal with any kind of disease back then. Why can't we use that to deal with problems now? And the answer is yes, we can deal with that. And you're not gonna believe how fast it works. A couple months ago, I had a patient who's a mother still breastfeeding, and she caught a flu from her friend who was visiting from China, and you can probably tell, like, if it's a foreign virus, it's gonna cause more problem to local people, because we're not used to that kind of virus and that kind of things. And she was very weak, very tired, and basically couldn't do anything. And but she came to clinic. I gave her, like, after a quick diagnosis, I know exactly what she need, and I gave her acupuncture based on her constitution, based on the pattern. And she, after like 30 minutes, she was feeling like 50% better. She was able to talk. She was like, her eyes were like brightened up. Like, when she came in, she was like, oh my God, I'm dying, you know. She's sleepy, very tired, and couldn't talk. So after 30 minutes, she was all better. And then I gave her medicine. I asked her to take it right away. And then within another hour, she told me she was almost back to her normal self. She was 80% better. And then she was able to have dinner with friends that night. And then I told her to finish the medicine, because I gave her like 3-4 days worth of medicine. And after that, she told me that it did not affect her milk production at all. It actually increases her milk production. She was very surprised, because she was really afraid taking the medicine will kind of reduce her milk production and then affect her son's breastfeeding schedule. But it worked out really well, and she was surprised, and she was really happy with how well it works. And actually, people did not know that Chinese medicine will help you treat the common cold or flu much better than Tylenol and Advils. So that's what I want you guys to know. And the thing I want you to learn is how to take a basic Chinese pulse to know whether your pulse is superficial or it's deep, whether it's exterior or interior. So let's recap. So normally when I take pulse for myself, I do it this way. Kind of put your hand on the back of your wrist and curl your fingers, and then kind of slowly feel for your pulse. Start with a very light pressure and slowly increase your pressure until you feel your pulse beating. So if you can feel your pulse at all 3 fingers, just when you're barely touching the skin, or when you just finger very light pressure on the skin, it's called a floating pulse. It's an exterior pulse. And that's the time when you could try to take a bath, or soak your feet in hot water, or even cover yourself up to break a mild sweat. If your pulse is not superficial and you have a common cold, you shouldn't do what I said above. You shouldn't try to break a sweat. You shouldn't take a really hot bath to break a sweat. It's not a good idea to do any of that. Also, there are 2 other essential factors that I said when to diagnose exterior syndrome. One, so like I said, one is the pulse, the floating pulse. 2 is the body ache or joint pain on your limbs, or on your lower back, your hips, or your the back of your neck or shoulder can be very tense. Oh, excuse me. And the third is having a fever and chills at the same time. When you have them at the same time, you're gonna feel your body's heating up, at the same time you're gonna feel very cold. You want to cover yourself up. You want to dress more, and you want to hide in under your duvet, your blanket. So when you have all these three factors, and we can confirm it's an exterior syndrome, then we can give you medicine or acupuncture or other methods to help you break a mild sweat to get rid of the virus and get you better. But if you don't have all three at the same time, it's better that you see your acupuncturist or TCM practitioner to let them help you to find out where the disease is and what your constitution is, so they can give you a better medicine to help you get better. The medicine will be customized to your situation, to your constitution. So if there is no question, I am going to leave it here. You can leave a comment if you didn't watch it live, and then I'll try to answer it as soon as I can. If you like my content, or if you have any suggestion for my future content, feel free to drop me a message or leave a comment. Like my Facebook page, or you can subscribe my YouTube channel, Andre Shi Traditional Chinese Medicine, or visit my website. It's at www.andreShihtcm.com, and I will see you next week. Bye.